Hello friends, welcome to my channel. Today in this video lecture we are going to discuss about complications of diabetes. Before we dive into the video, if you are new to the channel, please consider subscribing it for more such interesting videos. You can also join me on Instagram and Facebook where we do daily image-based questions. Currently we are doing amazing endodontic series and it's really worth watching. So please do join me over there. And to get a free PDF of any of my video lectures, you can get it from my Telegram channel. So now any further ado, let's get started. Both types of diabetes mellitus may develop complications which are broadly divided into two major groups: acute metabolic complications and late systemic complications. The complications which occurs due to fasting or not taking meals on time or missing the insulin dose or missing on your oral hypoglycemic drugs. Such complications are included under acute metabolic complications, and these are diabetic ketoacidosis, which is more commonly seen with type 1 diabetes, then hyperosmolar non-ketotic coma and hypoglycemia, and the late systemic complications which may develop after a period of 15 to 20 years in either type of diabetes. They are included under late systemic complications, and these are atherosclerosis, diabetic microangiopathy, diabetic nephropathy, diabetic neuropathy, diabetic retinopathy, infections, and seventh complication of diabetes is periodontal diseases, right? Now what happens in diabetic ketoacidosis? Ketoacidosis is almost exclusively a complication of type 1 diabetes mellitus. It can develop in patients with severe insulin deficiency combined with glucagon excess. As in this picture you can see, there is insufficient or absent of insulin and there is increased glucagon. Okay. Now why such condition occur? Failure to take insulin and exposure to stress are the usual precipitating causes. Severe lack of insulin causes lipolysis in the adipose tissue, as you can see. Okay, now our body organs need energy. Okay, as we have insufficient insulin, so glucose cannot get transferred to our organs, right? So now what our body will do? It will break the fat cells and muscle cells, basically the proteins and fat, and from which it will get the glucose, and this glucose will then transferred into different organs via blood vessels. Okay, severe lack of insulin causes lipolysis in the adipose tissue, as we can see over here, right? Once the rate of ketogenesis exceeds the rate at which the ketone bodies can be utilized by the muscles and other tissues, ketonemia and ketonuria occur. Clinically, the condition is characterized by anorexia, nausea, vomiting, deep and fast breathing, mental confusion, and coma. Okay. Most patients of ketoacidosis recover. This is one peculiarity which is seen with diabetic ketoacidosis, so you need to keep in mind, okay? So yes, for any diabetic patient, they have to remember it. But first, insulin. Do not miss insulin doses. The second condition is hyperosmolar hypoglycemic non-ketotic coma, which is also known as HHNC, okay? So what this condition is actually? In simpler words, loss of glucose in urine is so intense that the patient is unable to drink sufficient water to maintain the urinary fluid loss, which gives rise to this condition. And what are the clinical findings in this? Slow progression of the symptoms, okay? the hypoglycemic symptoms are slowly progressing in it. Then dehydration, polyuria is seen in the early phase and oliguria in the late stage. Changes in the mental status, possible seizure activity, and finding of volume depletion. Hypoglycemic episodes may develop in patients of type 1 diabetes mellitus. It may result from excessive administration of insulin. Remember this triad, okay? It may occur due to excessive administration of insulin, missing a meal, or due to stress, like in exercise. Hypoglycemic episodes are harmful as they produce permanent brain damage or may result in worsening of diabetic control and rebound hyperglycemia. And the symptoms which are seen with it are sweaty, hungry, confused, okay, blurred or double vision. Such kind of things are seen with it. Now in the late systemic complications, we have 7 complications of diabetes, right? So a number of systemic complications may develop after a period of 15 to 20 years in either type of the diabetes. 8 complications are largely responsible for morbidity and premature mortality in diabetes mellitus. As you can see in the picture, first we'll study the atherosclerosis, okay? Atherosclerosis. Diabetes mellitus of both type 1 and type 2 accelerates the development of atherosclerosis. The possible ill effect of accelerated atherosclerosis in diabetes are early onset of coronary artery disease, silent myocardial infarction, cerebral stroke, and gangrene of the toes and feet, right? Then in the diabetic microangiopathy, what is seen in it? Basement membrane thickening of small blood vessels. Please do keep in mind, okay? And also in the small blood vessels and capillaries of different organs and tissues like our skin, skeletal muscles, eye and kidney. Then the third complication is diabetic nephropathy. Renal involvement is an important complication of diabetes mellitus. Chronic kidney diseases with renal failure accounts for death in more than 10% of all diabetics. Renal complications are more severe and they develop early and more frequently in type 1 than in type 2. Okay? The neuropathy. Diabetic neuropathy may affect all parts of the nervous system, but systemic peripheral neuropathy is most common characteristic. Okay, so far we have seen 4 complications, right? Atherosclerosis, okay, then diabetic microangiopathy, in which the basement membrane thickening of small blood vessels and capillaries of different organs occurs, right? Then nephropathy, which is more severely seen with type 1 than type 2, and neuropathy. What happens in retinopathy is diabetic retinopathy is an important cause of blindness. It is related to the degree and duration of glycemic control. The condition develops in more than 60% of diabetics 15 to 20 years after the onset of the disease. Okay. Then coming to the 6th complication, which is infections. Infections like tuberculosis, pneumonia, pyelonephritis, otitis, carbuncle and diabetic ulcers. All such infections are common with diabetes, and specifically in these times, COVID is also having its worst effect on diabetics, right? Because of their decreased immunity in such patients. And the 7th complication of diabetes is periodontal diseases, which is, I guess, no need to explain here, right? So this was all about diabetic complications, and I am on my way to more such amazing great videos. So please stick to this channel and do share it with your friends. Thanks for watching.